right, we're here at Health 2.0, and I'm with Khaled Hasuna, who is the CTO of Medhelp. Khaled, you've been helping people manage their wellness. At this conference, we've talked a lot about not just managing conditions that people may already have, but also wellness. And your platform actually helps with both sides. So tell us more about what you're working on.
So at Medhelp, we focus on three main areas. We focus on communities, connecting people with other users who might have trying to solve the same health goals.
Right.
Connecting them with doctors, making sure that they can reach the right doctor at the right time, or interact with them online, even for either for simple things or for more complex things. And at the same time, providing them with a lot of health tools so that they can track their health and quantify it, not just deal with it as a qualitative thing, but actually understand how they're doing and how well it's progressing over time.
So what are some of these health tools that people use?
We have a wide range. So we focus on healthy living tools. So we have tools that help you lose weight, that help you have a healthy pregnancy, tools that help you manage your mood, etc. And they go all the way to more chronic conditions. We have tools to help you manage your chemotherapy, hepatitis C treatment, HIV medication, etc.
Right. Community, you spoke about that, and I think community has come up as a topic that is really useful for helping people achieve their goals.
Definitely, because one thing we noticed that people respond much better when they're interacting with other people rather than sitting by themselves and just managing their health themselves. And but also you want to the quantification and the involving the experts. So we feel that integrating community with the tools, with the doctors, is the winning formula. That's what's actually going to keep you engaged, because there's so much community people interact with and learn from, but at the same time have actual real data to deal with, not just very high level qualitative assessment of how your health is doing.
Right. I find it very exciting that we now have technology that can really help people reach these goals, and like never they could before. You know, you're connecting with people who might share the same goals, where within your geographic community you might not have that. And so tools like yours are very interesting in helping people build self-sustainability, personal sustainability. So give us some examples of people you've helped, or either patients or users, you call them. You know, what is a story that someone has progressed through in your platform?
So we have different stories. I mean, I'll give you one example. One user on Medhelp wrote to us once saying, "You saved my eyesight." And we're like, "How did we save your eyesight?" And he wrote us a long story about how she was feeling pain in her eye and migraine and a kind of pain. And then she called her doctor and said, "No, wait until the morning, it's perfectly fine." And then she ran across a blog on Medhelp from an expert who was talking about, she was searching, and her eyesight was getting worse. And they said, if you're on this pain, migraine medication, you might be getting high eye pressure. And if that happens, go to ER immediately, otherwise you might lose your sight. So they go to ER and they realize that her eye pressure is very high. And they, of course, put her medication, take it down. And then by the morning, she went back to her doctor and said, "You know what? You did the right thing by coming to the ER room, because if you haven't, you might have lost your eyesight." So just that integration of doctors talking about things that are relevant to patients, patient being able to find them, being able to discuss them and learn from them, can actually make a big difference for users.
Yeah, that's huge. And you're closing the circle and making it much tighter. And from a cost standpoint, you know, in this country we have huge high healthcare costs compared to almost every other country. We're paying 3x, 4x what they're paying. How will a platform like yours and other social platforms for healthcare, how will that help with the cost?
I think the cost is inflating because people are not taking ownership of their health. So what ends up happening is they're outsourcing that. They're saying, "I'm going to live my life the way I want, but the doctor's going to fix it." And that is never a winning formula. So the solution is for people to take control of their health, for them to manage how they eat, how they exercise, really understand what's going on with their health and be able to change their day-to-day life so that happens. And I think what our platform allows them to do is just that. It allows them to really take their health back, manage it, take ownership of it, talk to people about it. And what that means in the long term is that their health is going to get better and our costs are going to be controlled.
So have you used your own platform to manage your health?
All the time.
What health goals have you achieved?
I have quit my Diet Coke addiction.
Good for you.
I have lost 10 pounds, even though my wife says it's not enough yet. And overall, I know that if I have any question, I know where to go and that I can get an answer.
Great. Well, thank you for sharing your time with us, and all the best.
Thank you.
Oh, we didn't close with, sorry. I'll edit it in.
Oh, okay.
So for people who want to find out more about how to manage their own health and stay ahead of the curve in terms of prevention and wellness, what can they do?
Just go to www.medhelp.org and join 12 million other users.
Great. Is it a nonprofit?
No.
Okay. Okay. Well, thank you very much, Khaled.
Thank you.
All the best.
Appreciate it.